Hello, everybody. Thank you and welcome to today's webinar. I'm Dr. Eliza Chin, Executive Director of the American Medical Women's Association. And today is a special day. January 6th is the annual National Technology Day, which is why we picked this particular day for this webinar. We have a wonderful group of speakers and just honored to have so many here, including the editors of the newly published textbook, Technology and Global Public Health, Dr. Padmini Murthy and Dr. Amy Ansehl. Dr. Murthy is the Global Health Lead of the American Medical Women's Association. She is also Professor and Global Health Director at New York Medical College School of Health Sciences and Practice. Dr. Ansehl is Chairperson of the Visiting Nurse Service Foundation and Associate Dean for Student Experience at New York Medical College School of Health Sciences and Practice. We're very honored as the American Medical Women's Association to be hosting this webinar with these esteemed speakers, including most of the contributing authors of the recent textbook, Technology and Global Public Health. So to start us off on today's event is Dr. Nicole Santo. Dr. Santo is the current president of the American Medical Women's Association. She is also Associate Professor of Medicine at Mayo Clinic. So Dr. Santo, I will hand it over to you.
Thank you so much, Dr. Chin. I really appreciate that very kind welcome. And thank you so much for the honor of being here. It's really my honor to welcome everyone to this wonderful event as Drs. Murthy and Ansehl host what really promises to be an enlightening, excellent conversation with a truly marvelous group of international experts about the pivotal role of technology in advancing global public health. As Dr. Chin mentioned, Drs. Murthy and Ansehl are the editors of the recently published book, Technology and Global Public Health. This really promises to be an amazing discussion, and I'm so grateful to everyone, all of the speakers, Drs. Murthy and Ansehl, and Mr. Khwaja Shams, who's joined us as a special guest as well. Thank you so much, and I'll turn it back over to you, Dr. Murthy.
Thank you so much. Eliza, thank you, Dr. Chen. I turn it to you now. Eliza?
Yes, sorry. I'm going to go ahead and let you moderate from here.
Thank you so much. And thank you so much, AMWA. Thank you, Dr. Santo, always. And thank you, Eliza, my partner in crime, for everything we do. And also, it gives me great pleasure to have worked on this project with my dear friend and colleague, Dr. Amy Ansehl. And this has been a dream of ours for 2 years, a lot of blood, sweat, and tears. And without our contributors, we could not do it. And we would also like to extend a thank you to Springer, especially Janet King, for believing in us and, the countless emails back and forth. And before we get started, it really gives me a great honor, and it's a privilege to introduce Mr. Khwaja Shams, who has been an amazing supporter of the work AMWA does. But more than that, it is so nice that you arrange your busy schedule to be with us. Very briefly, Mr. Khwaja Shams is a leader in the high-tech industry. He's a real technocrat. And since it's Technology Day today, I mean, it's amazing. Really, we are so excited. I speak on behalf of Amy and myself to have you open the panel with your remarks. And he is currently a senior director of engineering at Google, where he leads and has led multiple teams applying machine learning to benefit billions of users all over. And Mr. Shams has had a long and illustrious career. He has a lot of patents. He's worked in Apple, and then he's developed a lot of, apps, and he has broad industry experience ranging from manufacturing, media, retail, banking, healthcare, and technology. So whatever Mr. Shams does, technology is at the heart, and he's also even, he's really an innovator, and he has helped a lot with our protective equipment, PPE, which we have given by, helping us with the 3D mask printing, face shields. We can really, we can't appreciate you enough for that. So now over to you, Khwaja. Thank you again.
Thank you, Dr. Murthy. It's a pleasure to be here today. First of all, I'd like to say thank you for writing this book, and I'd like to say thanks to all of the panelists and the authors Thank you, Dr. Amy, for inviting me, and Eliza and Nicole. Thank you so much for arranging this. I would just say a few brief things. I mean, as we are all hearing about the role of AI in medicine, I mean, a lot of hype, but a lot of real stuff there. Also, the advancements in computer vision or the sensor technology that's been deployed, multimodal sensors to learn and remotely monitor patients, the role these sensors are playing in chronic disease management, the role natural language processing is playing in terms of retrieving, whether it's the records or what people are saying in social media in terms of adverse effects of medicine. All of that is great. One of the most important things that I want to mention here today is while AI can be useful, whether it's in clinical decision support processes or classifying tumors or in the field of radiology and so forth. But the most important thing is to make sure that the data used for training AI models is inclusive of gender and the population from around the globe. And that is the hardest part in this process. The AI, in simple words, it generates what it reads or the data that's provided to it. So one of my requests to all of the technologists is to pay attention to the diversity of the data and make sure that algorithms are trained in an inclusive manner that represents, like I mentioned, all genders and people from around the world. The other brief thing I want to mention is, while in healthcare, the women participation is pretty high, we don't see that in computer science and in AI. And I'd like to encourage all of our contributions to make sure that women participate in the field of AI, particularly in the cross-section of AI in healthcare, to make sure that all of the issues are represented well. And with that, I would like to say thank you, Dr. Murthy, for inviting me.
Thank you so much. I really appreciate that. And it's really interesting how technology has really made strides. As we know, we have a COVID vaccine not made by one pharmaceutical company, but so many. And when Amy and I wrote this book, it was not COVID. We submitted a manuscript just before to the publisher before COVID hit. But what I would like to say is never in the history has a vaccine been made so fast. And that's because it's of technology, it's due to technology and the dedication of so many people. So with that being said, we will start moving on. And I would also like to invite Amy to say a few words before we hear from our speakers. Over to you, Amy. Thank you.
Well, thank you so much, Dr. Murthy. I appreciate all your support and obviously your tremendous expertise, because it is invaluable on a global stage and here locally to New York Medical College. So thank you for all that you do. It's been a pleasure, continues to be a pleasure to collaborate with you and all of our authors. I mean, what an incredible group of professionals we have. And of course, AMWA, we really appreciate and recognize the importance of your giving us this time today and in celebrating, global technology. And thank you, Mr. Shams, as well. We really appreciate your coming here tonight on such short notice. So, this book, what astounds me, Dr. Murthy, is how this book, just its relevance, to everything that we're doing. And, at the time, we didn't know that COVID was going to hit us, but the chapters, and I want to say this to the audience, so much of what our authors laid out is so relevant, for these times. And tonight, you're going to get a snapshot from several of our panelists who have written in the book, but we encourage you to get the book so that you can read more and you can learn more. And those of you that are educators, I think it's an incredible opportunity to share with your students, as well as if you're with a community-based organization, a CBO, you can share with your staff, because there's so much to learn. And tonight, within the time frame, we can only give you just a little bit. I'm now going to turn this back over to Dr. Murthy to announce our first speaker.
Thank you so much, Dr. Ansehl. I have to remind myself to call you Dr. Ansehl because, you know, after working for so long, almost 15 years together. One of the other things I would just like to add before we have our first speaker is this book is really unique, is because we drew upon the expertise of people from 10 different countries. We have contributors not only from the United States, but from Australia, from Saudi Arabia, from Japan, from the country Georgia, not the state of Georgia where the elections or the runoff was just held, but the country Georgia, Taiwan, India. So we have so many people who have contributed to this book, and it's really fascinating. And one thing about, it's not that we do it for the money. For those of us who write, it's not a fiction, but this is really facts with so much of work which has gone into it and continued research. So this project has been almost in the making for 18 months to 2 years. And we would also like to extend a thank you to our students who have worked with us. And we always make it a point to mentor our students too. And, some of them have co-written with us, and they've even done a lot of the legwork for that. So we are thankful. And without much ado, our first speaker is Hiba El-Jabreen. Dr. El-Jabreen is from Saudi Arabia. She is assistant professor in information technology in the King Saud University. And due to the time difference, she conveyed her apologies, but she has sent in her tape. And Kayla, may I request you to kindly play her presentation, please? And that's the power of technology. Thank you.
Hello, everyone. This is Hiba El-Jabreen. I'm assistant professor in King Saud University, and my chapter is about health transformation in Saudi Arabia via connected health technologies. The main motivation of this chapter is because Saudi Arabia is one of the largest Arab states with a population of over 33 million citizens. Millions of dollars are actually spent on services that can be replaced with e-health and connected health technologies, and these technologies can be of great benefits to people who live in rural areas because it can reduce the travel time, expenses, and the stress involved in such traveling. So the widespread population and the vast expanse of the country is actually the main factors that motivate and drive the adoption of connected health in Saudi Arabia. For that reason, this chapter focuses on the transformation strategies and how it is implemented in Saudi Arabia to empower connected health and introduce virtual healthcare in Saudi Arabia. For that reason, this chapter highlights connected health and what is the definition of connected health, and then go deeper into the transformation of healthcare in Saudi Arabia. We highlighted the National Transformation Program. We talked about the 37 strategic objectives in this program and the transformation that is proposed in addition to the model of care actually in Saudi Arabia that is proposed with respect to different key enablers. And then we went deeper into the connected health technology that is proposed under this model of care. After that, we also talked about how the development of connected health in Saudi Arabia have been introduced in the past couple of years. We talked about the governmental contribution in that aspect, different projects that have been implemented in the past couple of years. We also highlighted the literature development on how researchers actually contribute in this aspect. In the end, we talked about how connected health is advocated in Saudi Arabia and will be advocated in the future. We talked about the future governmental direction. We highlighted the scheduled projects to be implemented in the next couple of years. We also talked about the future research directions and what kind of research questions that is still open for contribution in the literature. And in the end, we highlighted a case study in collaboration with MIT Hacking Medicine that was implemented in 2018 in order to advocate the use of connected health and e-health in Saudi Arabia. So in conclusion, this chapter will allow the reader to see how Saudi Arabia investment in connected health can bring more effective and safer services into the system of healthcare services in Saudi Arabia. The connected health can increase the productivity and healthcare and create also new knowledge industries. In the future, we can see that the new model of care will improve the implementation of the services in healthcare around the country, and we are very enthusiastic to see such result in the near future. With that, we conclude the highlights of the chapter titled Health Transformation in Saudi Arabia via Connected Health Technologies. It's been a pleasure to be part of the Technology and Global Public Health book, and also a pleasure working with the editors and our whole team. Thank you everyone for listening, and have a wonderful evening.
Thank you so much, Hiba. And I would just like to say, Hiba was instrumental because she developed an expert system that could detect errors in medical prescriptions using data mining techniques during her PhD. That's what her dissertation was focused on. So thank you again, Hiba. We really appreciate it. And now moving on. And the other thing I would like to say, housekeeping rule, when you have questions, please type them in the Q&A box and we will field them. And our next speaker, unfortunately, Dr. Satoshi Izo from Japan, who is with the he's the Director of Global Health in the Division of the Ministry of External Affairs. Unfortunately, he has a COVID emergency, not that he's sick, but Japan has imposed, stricter measures, and he had an early morning meeting because they're 12 hours ahead. But he asked me to convey his regards and just a few points from his chapter where he talked about universal healthcare and technology. Because audience, ladies and gentlemen, all protocol observed, and panelists, esteemed panelists, that Japan, along with Georgia and Thailand, were the main drivers of the universal healthcare movement in the United States. So in the United Nations, and these countries were the first who signed on and started this whole thing, the importance of universal health coverage, and that they had an umbrella onto which everybody needs to come on so that they can access all the necessary healthcare. And they did it using low cost technology. And one of the things I just would like to briefly mention, which he requested me to mention about, that Japan has come up with the concept of Society 5.0 for promoting the Sustainable Development Goals, especially Sustainable Development Goal 3, which focuses on health for all at all ages. And that is the 5.0 goals are, they have come up with a guideline for facilitating science, technology, innovation as a mechanism to fuse cyberspace. That means using space technology and physical space in order to bring about a humane-centered society that balances economic advancement while focusing on the social determinant. So this was one of the things, and Toshi and his team, and we hope from AMWA to host him again. He is very willing to come back. The whole issue was this COVID thing. So this is what he wanted me to stress. And he also said that we can achieve universal health coverage even in the United States by using low technology. And we have people like Khwaja Shams to thank for, because they're using technology to promote healthcare. And Hiba, who's basically a computer scientist who also used technology. So to promote healthcare is like a three-dimensional puzzle because we need everybody. So thank you again, Hiba. We really appreciate your contribution, and also a big shout out to Dr. Satoshi. Our next speaker shares my same last name, Dr. Murthy Gokula, who is attending medicine at Mercy Hospital, Ohio. But he has been focusing on a lot of innovative low-cost technologies in India. And I turn it over to you now, Dr. Gokula, to give us your remarks. Thank you again.
Thank you, Dr. Murthy. It's been a wonderful journey trying to establish this network and doing the chapter Telemedicine in India. Growing up and finishing medicine and being in US for 20 years, my journey in telemedicine started 6 years ago. And my primary reason why I wanted to do telemedicine in India is to kind of bridge the gap, wherein 75% of the doctors live in the urban areas, but 75% of the population live in rural areas, and they don't have access. And basically, I'm sorry to say, but we have quacks actually taking care of them called RMPs. And it bothered how it became very difficult for good healthcare for the rural population. And that's what brought me to start telemedicine in India. In 6 years, we've been doing telemedicine with Zoom, actually works in low bandwidth. I ran into a company called Health Cubed. It's a digital device which does point of care testing of 33 regular, like CBC, hemoglobin, cholesterol, syphilis, typhoid, gonorrhea, HIV, hepatitis. And it also has a cloud-based platform. And we actually screened about 250 people with corporate social responsibility funds with IDEA, and got enormous experience in the last 5 years. And that's why I was excited to write this chapter, Telemedicine in India, wherein Apollo Hospital was the predominant one. ISRO was the champion. But it didn't really pan out until the COVID pandemic, wherein public sector people have come with several platforms. And now there's so many telemedicine platforms, it's hard to control. And I think Medical Council of India, along with the government of India, now released fresh set of guidelines. And there are about 20 pages of guidelines that are so generic, nothing specific. So I've been very involved with the American Telemedicine Association. And my practice in the United States is concierge connected care. I'm a family physician and geriatric specialist, plus lifestyle medicine physician. And I'm trying to do remote patient monitoring, disease reversal, chronic disease management. And if you look back in India, there's a changing paradigm because of the westernization and the globalization, that there is 1 in 5 Indian is a diabetic now or pre-diabetic. And how do you manage this epidemic in India? And I thought, so this year we developed a platform and we'll be releasing it soon. And we wanted to focus on the NRIs through remote patient monitoring. And the sad part is we don't have much of indigenous technology. I don't know if Khwaja Shams has ideas about what are the remote patient monitoring manufactured in India. We still have to depend on outside devices to kind of promote, except for Health Cubed, but still they bring parts and everything from outside. And so there is a lot of demand and need. And the forecast recently published the data that how much you can actually gain by doing telemedicine in India. But I don't think it's a structured and a centrally coordinated approach there. It's everybody's picking their own piece, like me and Apollo Hospital obviously was. But even when I talked to them 6 years ago, their model was more like a channel to refer to their tertiary center rather than actually deliver care processes and care delivery. For me, why I like to kind of do is because I think this can disrupt primary care. And I don't have to convince anybody in this world that majority of the population needs primary care. And I don't think, and everybody in this panel must have experienced, we really don't need every visit to be in the office of a doctor. Yes, it's very important, but the first visit and the follow-ups could be that, and most of it. So telemedicine would be good because we don't have enough specialists. We don't have enough primary care. And the government is doing all, including now asking Ayurvedic practitioners to be able to do surgery and to cater to the demand of the local population there. So one of the things that I'm going to do now is to tap into the retired pool of doctors and try to see if they can be hired to be doing this kind of services based on specialty. And people still in India want specialist care. They're not really in the model of, I tried, but I didn't really succeed in trying to create the concept of family doctor and trying to implement the United States Preventive Services Task Force screening guidelines and all. But that's the way I'm trying to envision care and disrupt primary care in rural India. And I don't think anybody will disagree with me that human potential cannot do this. It's only technology which you can actually put the process in place and actually scale this. And I'm going to kind of say that this year I'm very happy that we have the right team on the ground. And Health Cubed also has transformed into a new remote patient monitoring device and aging well. And I work with the Indian Society of Lifestyle Medicine, and I'm focusing on disease reversal, chronic disease management through remote patient monitoring and telemedicine. And how do you disrupt healthcare? We're a small startup, but I think there's a lot of potential, and I see, but trying to work with the government as a small player is very difficult in countries like India. You need to have a lot of power and pull and muscle behind yourself. And I met many government district collectors. They all agree, but then when you come to the lower level of officers, they have their own agenda. And for the last 6 years, I've been trying to do this. But telemedicine, I think, is the only way that you can actually create equality and kind of create that universal health that you can deliver. And I don't see any other way. Even though the healthcare is free in India, it doesn't come across equally to everybody. But you have seen in the last 10 years, the technology has disrupted Indian society with WhatsApp on every person, including a guy who begs on the street, uses WhatsApp. I have interviewed several people who beg on the streets. Literally, I'm not kidding. And I've seen WhatsApp on their phones. And now I'm thinking of how you can actually use WhatsApp to educate these people in some of the infectious diseases, prenatal health problems, they reduce the infant mortality rate. And these are all some of the things that are going across my mind. But I think that's why I'm excited that telemedicine is the way to go in India to kind of create delivery of care across the spectrum of population.
Thank you so much. Really appreciate that. And also the other thing I just wanted to say before we get our other speaker is something Mr. Sham said. You talked about gender equity, and one of the things which has come to my attention and a lot of other people who get their hands working in women's health issues, that a lot of women physicians in many parts of the world are being harassed. They're being cyber stalked and cyber bullied by people pretending to be patients. So that is the downside of telemedicine with regard to especially women physicians and health practitioners, women health practitioners. So one of the things is in one of the chapters in the book, which I had one of our students work with me on, we talked about how technology can be used to address violence against women. We have a lot of apps. For example, the president-elect, soon to be, not to bring politics in, but Joe Biden has been such a proponent of, measures addressing violence against women. And Circle of Six was an app which was developed by a young woman who was the victim of date rape. And she was even invited to the White House when Biden was the vice president. And there are several apps like this. So it's really important that while, yes, there are, people are being teased, but there is also the good thing about technology, it's like you prescribe steroids, it's like a double-edged sword, is the technology can be used to prevent crime too. So thank you again so much, Dr. Gokula, and good luck and keep us posted. We'd love to work with you from AMWA to get this going, because this technology needs to be shared. And our next speaker
Happy to share. Thank you.
Yeah, thank you so much. Is Dr. Sean Kivlahan, who's the Director of International Emergency Medicine Fellowship in Brigham and Women's. And Amy and I are so proud of Sean because he was one of our star pupils. And, he's kept in touch these 11 years. And every time Sean does something, I get a message from him. I get an email or a text like, Sean, thank you so much for all your work you're doing in promoting global emergency health for those who need it using technology. Over to you, Sean. Thank you.
Thanks so much. So thank you again for having me here and for the opportunity to participate in this book. Dr. Murthy and Ansehl were both mentors of mine and continue to be. So it was great to take part in this. I also want to quickly say thank you to the two other people that co-authored this chapter with me who aren't here, Drs. Erica Nelson and Nirma Bustamante. Dr. Nelson is also a faculty at Brigham and Harvard Humanitarian Initiative, where a lot of our technology and global health work is based. And Dr. Nirma Bustamante used to be one of our fellows, and now she's with the CDC, where she's the Mexico country director. So, but also still affiliated with our tech work at Harvard Humanitarian Initiative. So I'll give a quick overview of the chapter, which is technology in global public health, and specifically in disaster response, which has taken a really significantly growing role over the past few years, and even more so now with COVID, as was brought up by some of the other speakers. So think first to when something happens in the world. These days, the most accurate and timely source of news is not the news. It's definitely not a newspaper, and it's not even watching the news, but it's Twitter, it's social media. If you want to get a minute by minute, and today was a good example of what was happening in Washington, when I wanted to know what was happening, even the New York Times website wasn't fast enough. You go to Twitter, and that's where you get the breaking news. Disasters are the same way. So you can mine this information. When a major earthquake happens, or a hurricane or a tsunami, or a conflict situation is evolving, the information gap is massive on the front end of the response. The first people going have no idea what they're getting into, and that affects the response because you don't know how many resources you need, both material and human resources, or what you need to prepare for. Social media, as long as the cell towers are still up, is a great source, and now there's programs where we can actually mine this data and see who's asking for help, where are buildings collapsed, where are systems down, and even if systems are down, we can use it to indirectly map out the severity of a disaster, and it's one of our first lines of work now with our response networks. Building on that, we can determine where people need help based on who's asking for help on social media and blasting out messages through government channels that help is coming. The cell phone penetration is so high now, it's in the mid 60% globally for the world and growing quickly, and even with smartphones growing quickly, that people have access to apps and we can capitalize on that. So we can use this to disseminate information on where, for a major disaster, where housing is, where resources are, distribution points for food and water and things like that. And then we've also taken it for our information collection. So when you do humanitarian response, one of the first jobs is to determine how bad is it and what the needs are. And for a long time, this was done via aerial surveys and helicopters, which you can imagine is expensive and dangerous, flying over, and then cross-sectional surveys through disaster areas and doing cluster sampling, which is just not that effective and takes a lot of time and can take days when you need help in hours. So now we can blast out apps that will allow beneficiaries and people to actually just fill out the data that they need. We send our teams with tablets, and there's many different programs, but the one that OCHA, the UN Organization for Office for Humanitarian Affairs, uses is Kobo Toolbox, which is just a tablet app where you put in the information. And now if you have, imagine 30 NGOs responding to a disaster, they don't have to all get up and meet the next day and cross-reference their data. It's instantly uploaded to the cloud, and somebody can be compiling it all and mapping out the disaster in real time. So It's a great opportunity. And then replacing the helicopters, now we have drones. So we can send up drones to do aerial surveillance and mapping. And now even taking it further, we can have live satellite links and we outsource it and crowdsource response. So we have people at home looking at the satellite links of the maps, mapping out areas of potential need and disaster. And you can get this work done so quickly and get help to people that need it much quicker than we used to. It's really kind of mind-blowing when you think about how we used to do it on pen and paper and on foot and how much longer it took and how much less effective it was. So the technology has grown and enhanced response. Another great thing is the cloud. So the ability to have cloud technology, just a simple Dropbox account or Google Drive or whatever you may use, allows you to have all policies, procedures, protocols, manuals, everything is online. So you don't have to worry about lugging huge bags and boxes of material at different places, and you can get information out quickly. To talk a little specifically about COVID, and it's some of the mapping that technology allows us to do is looking retrospectively at or even in real time at searches, people searching on Google for different diseases and people have tried to look at this with the flu. And although it's not perfect, it can still give us some idea. And if we map it geographically, where are people looking for cough syrup? Where are people looking for hospitals? Where are they looking for help? We can identify hotspots on a map of where resources need to go. So that's the response side. And then quickly I'll end with the preparedness side, where it also helps. So early warning systems are one of the holy grails is to get an earthquake early warning system, which we're not quite at yet. But the USGS has its Did You Feel It app, and Berkeley created the MyShake app, which is USGS is partnering with. And it's in the process of hopefully giving a few seconds of early warning when an earthquake starts to happen to people in the area so they can get out of their house. And maybe that 5 or 10 seconds could be enough to save their life. So early warning systems like that. And then there's all the modeling to look at how bad a disaster can be and what resources we need. And people are becoming kind of couch epidemiologists now. And it's funny to hear my mother, who has no training, talk about the R0 that she sees on the news. But it's great to see that people are getting involved in this and the ease of use. And now with the computer technology that's so readily available, and that we can really model things and be much more prepared, which saves money, which allows us to spread thin resources even further. So yeah, there's so many other things. You can read the chapter and dive in. Those are just a few samplings, and I hope you enjoy it. And if you do take a look at it, please, and you have questions, please feel free to email myself or the other authors, Dr. Nelson or Dr. Bustamante, anytime. Thanks again. Thank you again for the opportunity, Dr. Murthy and Dr. Ansel.
Thank you, Dr. Kivlahan. I have to get used to calling you Dr. Kivlahan instead of Sean. And full disclosure, the reason Dr. Ansehl and I reached out to Sean is not because he was one of our star pupils, but because of the tremendous work he has done. He's like really been amazing in going to the most forsaken ideas. Like I'll send him a text, I'll hear back, oh, sorry, Minnie, I was somewhere with no phone connection. Like, Sean, hope you're safe. I'm sure your mother said the same thing to you. So I just want to congratulate you, Sean, for all the work you and your team are doing. And I hope you continue to train so many more people to use technology, especially in global emergency medicine. Now, I would like to turn it over to Dr. Ansehl, Amy, to call upon and introduce our next speakers. And housekeeping rule, if you have any questions, please type them into the Q&A box. And once everybody is finished, we will have a Q&A. So over to you, Amy. Thank you.
Thank you. Thank you. Excellent presentation, Sean, and the other speakers that preceded me. And thank you, Dr. Murthy. It is my great pleasure tonight. Tim Letty, who is unfortunately unable to be here because he's recovering from COVID right now. So we wrote the chapter together, and I've been the agency chairman of the board for Visiting Nurse Services, as well as I'm now currently elected for a 6-year term to be the foundation chair for Visiting Nurse Services. And I'm going to kind of talk to you about our chapter, which is telehealth and home care agencies. So I want to now kind of get everybody to focus and everybody to think about we're all over the world, but where now we have the ability, because of technology, we have the ability to be in everybody's home all over the world. Isn't that amazing? And just think of what that can do in terms of healthcare access, equality, eliminating disparities. You know, there's so much that can now be done because of technology in the home. And this chapter, which I encourage you to read, as well as all the other chapters in the book, talks about, you know, we've all heard the WHO says, and I love this saying because it's so true, think globally and act locally. And this chapter, and what I'm going to talk about right now, I'm going to try to put that into practice for you and make that real. So in the chapter, we discuss the different forms of technology that can be used in chronic disease management. We know non-communicable diseases, chronic disease management. We heard from Dr. Murthy Gokula, we heard from our other speakers, all about chronic diseases. And we know it's an epidemic of whether it be diabetes, heart disease, different cancers, and now we have the horrible, highly infectious disease, COVID, you know. But technology, we can bring it into people's homes, and we can use it to help them. We can use technology to make them feel better, improve the quality of their lives, and also level the playing field. And I'm going to give you a few examples that are not in the book right now that are happening in real time, because since the book was put to press and published, we've had this major problem with COVID-19. So you may be thinking, what are home care agencies doing? And I'm going to talk a little bit about Visiting Nurse Services in Westchester, which is a 120-year-old agency that serves people all over the Bronx, Westchester County, Rockland County, Dutchess County, Putnam County. So we're talking about a reach of probably close to 3 million patients. And what we've been doing there, and we had to do this very quickly, is we've developed policies and procedures using technology. So now every nurse that goes out to the home, even before the nurse goes to the home, has an app. And we have a policy for using that app, and we're using technology to monitor the patient's blood pressure and all the other vital signs. We all know how important O2 sat levels are in terms of COVID-19 and making sure people don't crash, making sure people can get to the hospital in time. So telemedicine, telehealth, being able to connect, figuring out whether or not we should even send a nurse to the home or whether the patient should be going immediately to an emergency room has been essential. I also want to let you know that in the field of technology, there are some very exciting programs that are helping people day in and day out. Elderly people, we heard about, about the geriatric population. I know Dr. Murthy Gokula mentioned to us about what he's doing. Well, we have a Care Connect app. So we can literally, through technology, connect the seniors in their homes who maybe they're homebound. So you have a whole population all over the world of people who are homebound. But through technology, we can connect them to Care Connect programs. In the United States, we connect them to the senior centers. There's an interesting new program that we're piloting right now called Gentronics. And Gentronics is a home rehabilitation program. It's done virtually. So there's so much rehab that needs to be done even after people leave the rehab center. And this particular program that we're working on, and I'm sure there are many other startups that are doing this, this enables, someone who's in a home to be able to have the access to physical therapy, to occupational therapy, to speech and language pathology. So what I really want to, before I turn this over to the next speaker, I want to really tell you how important that technology is as a driver, and how important it is a driver of equal access to healthcare, and how important it is, going forward, not only with COVID, of course, with COVID, but with all these chronic diseases. And if you think about all the apps that are out there that, you can utilize, perhaps you have an elderly parent or a loved one who has healthcare issues in their home right now. There's so much that you can use that it enables you to be able to monitor your loved one because of technology in the home. So thank you for now kind of the past few minutes spending this time with me to really think about and focus on how technology, is a great influencer in terms of advocating for the healthcare of people in their homes all over the world. And I'm now going to turn this over to our next speaker, which is Roya Mahoob. Roya, if you can just unmute, please.
Hi, everyone. Thank you very much, Dr. Murthy, and thank you to all the contributors of this book, Technology and Global Health. And I'm really glad to have the opportunity to contribute my experience to the book, and I appreciated your support of my work. As I mentioned in the chapter, my main purpose is to get the tech into the hands of the young women to make it accessible to them and to make a STEM and tech education fundamental component of the educating the girls. I believe that technology can support human talent to tackle the urgent social needs of women, providing undeserved population with a pathway to digital literacy, soft skill training, sustainability training, community building, which transfer the society in which they live for a better. What we are doing at Digital Some Fund, we are providing access to technology for thousands of the girls, young girls, to learn about the STEM education. Some of you maybe heard about the Afghan Girls Robotic Team, the Afghan Dreamers. I'm really humbled to be one of their coach and mentor, and these girls are brilliant. We started this team in 2017, and I'm really glad to see this team went to so many stages and win many of these stages, and showing and changing the not only the women's view that they can see themselves differently in Afghanistan and conservative countries, but also they will be able to change the men's view on the women's ability in science and technology. They proved that after years of darkness and subjugation, Afghan girls could finally take charge and be a master of their own destiny. This was a courage. This courage was the power of our youths. During the pandemic of the COVID-19, these young girls, when they learn about the skill of technology, they feeling that they are responsible citizen, and they have to contribute to their communities and society. So they get partnered and they work with professor from MIT to building open source ventilator. They also use the UV technology to building the UV robot to clean the viruses inside of the room. And they also building the spray robot and online computer game and many other innovative approaches that enable us to fight coronavirus during the pandemic. In fact, by allowing them this opportunity to take innovative prototype solution back to their own communities, we are giving them a chance to change the lives of children and women throughout Afghanistan and become master of their own future. Because of their work and advocating of women's participation in technology, engineering, and mathematics, Afghanistan governments today is going to invest to giving 10 acres of the land that they can build the first school of STEM. This institute will offer STEM education to high school students with emphasizing on AI, blockchain, cybersecurity, and robotics. I believe that in an age where technology advancement allow for interest and competition in global markets, our countries, especially countries like Afghanistan and European countries, must direct resources and effort to increasing our youth's knowledge and prosperity. Advances in technology can create opportunities for individual communities and countries. In order to compete and prosper in 21st centuries, all European countries must be able to access to the groundbreaking technologies that transforming our world and realize the talent of all their citizens. Otherwise, this would vaping the gap between the world's richest and poorest communities. I believe that robotic team was the first step in our journey for equality. The second step is that we have to invest in education, especially in STEM education, because it's an engine for regional development, peace, and prosperity. Education in the STEM subject, especially for young girls, will unlike multi-generational potential in a nation, especially in countries that are recovering from conflict. The low-wage factory jobs have been a primary route out of the poverty for many of the young women in Afghanistan and South Central Asia, and it might have benefited the communities and families. But low-earning jobs are a pathway to economic inclusion that will increasingly tapering off because the robot and machines will take over the repetitive task. And I believe in the broad new world, young women will need to seek opportunities for building individual wealth. And system-wide STEM investment at secondary and higher level education will shape a trajectory for job creation, economic progress, and ultimately more inclusive and peaceful societies. And thank you very much for giving me the opportunity. And I think that if we will be able to create in the community of the more young women that they learn about the STEM and they can be involved, it's not also help the economy increase, but also it's going to help the health and public health as well in a societies like countries like Afghanistan. Thank you.
That was excellent. And I just want to make sure that everyone's aware that Roya is the founder and the chief executive officer of the Digital Fund. So congratulations on all your wonderful work with that, Roya. Dr. Murthy, I think you wanted to add something as well.
Yeah, I just wanted to say that, give a shout out to Kayla Lee, who's done an amazing job in doing all this. Kayla is one of our assistant directors, and thank you, Kayla. We couldn't do it without you. The other thing I just want to bring up is this is a non-political discussion. And when we talk about an app which was promoted by one particular vice president, it's because I know the founder of the app, this young woman who created the Circle of Six. So I just want to say that all the opinions expressed here, because there was a comment posted on Q&A. So I want to answer that publicly before we go on. And thank you, Dr. Ansehl, that all of us are talking about this in technology. And that is why whatever was discussed is that was, the example given. Thank you so much. And also just to add that Roya is from Afghanistan. And Roya, thank you so much for all your passion you're doing. And I think you were one of Time's most, one of the people recognized by the Time magazine. So thank you again, to you and all the panelists. And thank you for being such a role model for young women. Back to you, Dr. Ansehl. Thank you so much.
Thank you. Excellent points, Dr. Murthy. It was with great pleasure now that I also introduce Dr. I call her Aishu, but Aishuara, and pardon me, sometimes my pronunciation is not what it should be. And I apologize in advance to anybody for that. I'm trying very hard. Narisama Devera, who's from Chulalongkorn University in Thailand. And I apologize for not saying it right.
No problem. Thank you. You pronounced it perfectly. So thank you very much for the introduction. Greetings, ladies and gentlemen. My name is Aishwarya Narasimha-Devara, and I'm a PhD student in international development at Chulalongkorn University in Bangkok, Thailand. My co-author Renuka and I have written the chapter M-Health for Better Quality of Life, Healthier Lifestyles, and More Meaningful Lives. So this chapter, what we wish to aim in this was to discuss the importance of mobile health, also known as M-Health. I know some of my fellow panelists have discussed some of the references to this, but just to introduce this and to give general background information, M-Health is to provide health services around the world through technology with civil society, governments, and the private sector. The services are delivered with mobile phones and other wireless solutions through the use of short messaging services, also known as SMS messages, multimedia messaging services, also known as MMS, voice calls, video conferencing, automated sensing systems, along with other data analyzing devices and applications. The use of M-Health has enabled healthcare providers to work in rural and low resource settings through innovative approaches. And as some of the panelists have mentioned, including Dr. Murthy Gokala, using these different services to really reach out to some of the marginalized communities and people who may not have access to these services. So, and I would also personally like to also convey my gratitude to all of the individuals who are working to make strides in this field. Now, and another example to add to this conversation includes what we have done in our research, Renuka and myself, is the application M-Diabetes, which was launched by Arogya World and Nokia Life in India as a public health awareness campaign on diabetes in 2011. The program included sending free evidence-based health SMS messages in collaboration with Emory University in the United States twice per week over a span of 6 months with 1 million participants. And some of the results included the participants increasing their exercise frequency and their intake of fruits and vegetables. So you can see this is one approach. And as we were researching, both my cohort and myself, we really wanted to see globally what were some of the innovative approaches using health to achieve this third sustainable development goal in the United Nations 2030 Development Agenda. So another example that we draw reference to is with regard to health is the application Guardiões da Saúde, also known as Guardians of Health in Portuguese, which was developed by the Brazilian Ministry of Health, the School Global Threats Fund, and the Brazilian e-startup EpiTrack to contain the spread of the Zika virus in 2016 in Brazil. This application can be used on the internet and the mobile and enables users to report any symptoms of the virus by answering questions, and also uses a map to trace locations of the virus spread. And as some of the panelists also have discussed, especially now during the COVID-19 pandemic, we've been seeing the use of contact tracing applications that have also been very useful in helping to identify individuals who may have also contracted the virus and are exhibiting symptoms of COVID-19. And again, helping all actors to understand where the spread is. So we can definitely see the relevance of mHealth in combating the COVID-19 pandemic. The use of mHealth is to complement existing health services and through an evidence-based approach and multi-stakeholder collaboration, it serves as a catalyst for universal healthcare coverage, as especially the moderators have very much highlighted. Personally, we enjoyed writing the chapter as we have an interest in the topic and its related backgrounds, and look forward to working on development projects in the future related to mHealth. Renuka and myself convey our gratitude to the authors for providing us the opportunity to contribute to the book. We also thank the organizers for providing us the opportunity to share perspectives on the panel. And of course, together, with technology, we can enable individuals to lead meaningful and dignified lives. Thank you very much. And I pass it back to you, Dr. Ansehl.
Thank you. That was excellent, Aishu. We really appreciate that. Now I'm going to move this forward to our next speaker, Dr. Gopal Sankaran, who's a professor of public health at Westchester University. Take it away, Dr. Sankaran.
Good evening. Thank you, Dr. Murthy, and thank you, Dr. Ansehl. And I also want to thank the American Medical Women's Association for providing this opportunity. And I want to thank all the previous speakers. I learned a lot. I learned a lot in a very short period of time, and I am amazed at the utility of technology which we are doing right now. We are practicing what we are teaching, I guess. The chapter which I wrote was leveraging technology for attaining SDG 3. So it's essentially divided into three major components. The first component is looking at the SDG 3, what it means, and then differentiating it from MDGs, the Millennium Development Goals. I just want to give a couple of items in terms of the flavor for what the differences are. The SDG 3, as you all know, is to ensure healthy lives and promote well-being for all at all ages. So it essentially takes a life course perspective. So it's not something which is done cross-sectionally at any one particular age group or for any one particular group of people. It is for bringing everyone from what we would characteristically say as the womb to tomb care, not only in terms of the medical care, but also in terms of the wellness and the well-being of the person in their totality. There are 9 targets which are presented against the SDG 3, and it's illustrated in this particular chapter. But the key difference between the Millennium Development Goals, which were valid from 2000 to 2015, before the SDGs came into the picture, is that the SDGs encompass every nation on this planet. The MDGs were focused towards the low and perhaps the low middle income countries, whereas this is focused on everyone. So we are in it together. We are in one big ship, if you will, in terms of sailing the same stormy sea, in terms of reaching where we need to reach. That's one thing. Secondly, the SDGs, when you look at it, not just the SDG 3, but look at, for example, SDG 1, which says no poverty, just abbreviating it. SDG 2 is zero hunger. So these are in absolute terms. So we cannot in 2031 be sitting over here, those of us who are fortunate to be around with COVID-19 flaring up again, we cannot be sitting around here and saying that what did we achieve or what did we not achieve, because we should have achieved these things. So that's the major theme which is brought out in that first part. Apart from that, one other important piece where technology comes in is technology was more of an add-on when it came to the MDGs, whereas technology is integral to the success and attainment of all the SDGs. So that's an important piece which I want to mention before going to the next one. The next one is the technology itself. Everything about technology is good, but anytime you see but, it means that there's something to be mentioned which may not be so positive. One, it is very expensive when it is introduced. Prices come down, but when it is introduced, it is expensive, and it usually has a short shelf life. So we got to be able to leverage that to bring the improvement to a large number of people. The Lancet Commission mentions frugal technology. What does that mean? Frugal technology is technology which is good for high-income nations, high-resource settings, is not going to work very well, or is even going to be adaptable in places which do not have the same kind of resources or do not have the same kind of facilities, even to take care of the technology or to repair the technology, if you will, going back to the mechanistic terms, it's going to happen. So that's something which we need to understand. Social media in health has really been extremely good in terms of bringing individuals, communities, and organizations together and to the forefront, whether it is in terms of ICT, information, communication, technologies, reminding people, facilitating participation. A number of examples have been given over here. For example, Aishwarya talked about the M-Diabetes app. So there are a lot of things which are going to be very critical in terms of chronic disease management. But remember, we do not want to be in disease all the time. We need to be in terms of health, and that is one of the challenges in terms of how do we bring the positive messages back to the people in terms of utilizing the social media. And the good thing is that social media has been in the plans of many nations. When I talk about many nations, in 2015 itself, there were over 120 nations which has adapted national policies, whether it was ICTs or e-health and telehealth. So the challenge now is to bring those things to operational level, not just the strategies, but to bring down to the operational level. So what is the reality? The reality in 2021, we are facing it right now. But when the chapter was contributed, it was still 2019, it was the pre-COVID-19 era, but it was very clear that there are haves and have-nots, and technology can actually accentuate some of this distance which is between the haves and have-nots. For example, when we talk about automation, AI, machine learning, and robotics, they are all extremely great, but there are people who are afraid of them. They're worried that the repetitive jobs which they do every day might be replaced by this technology. And if that were to happen, what is going to happen to them? And when I say what is going to happen to them, I don't mean the worker, I mean the entire family, which depends on that particular worker. So we have to be careful in terms of technology transfer, if you will, and we have to be cognizant of the fact that whether it is scalable, and if it is scalable, is it really sustainable? And there are a number of excellent things which have occurred. We talk about kangaroo care, we talk about solar claves, and so on and so forth. But the question is, are these things sustainable? The Lancet Commission also mentions that technology is in some places not existing. Some places technology exists, but it's not accessible. And finally, we have accessible technology, but it doesn't get adopted for a variety of reasons. And so the third piece in that particular chapter is looking at what could be done. We have to move the health interventions from institutions to people's homes. There's no doubt about it. Several speakers have alluded to that, whether it is mHealth, whether it is eHealth, whether it is telehealth, that's the future to go. So we cannot be expecting people to come to places. We have to take and penetrate, just like the television did, just like the cell phones have done. We have to make sure that the technology has got a door open or a window open into every home, every place on this planet. That's important. And then we have to align health around a national vision and strategy with sustained commitment, investment, and political will. That's important. Because all these things which we create in terms of plans, they sit. If they have to mature and if they have to be brought into focus, they have to be brought within the health systems which are already in place, and they have to be brought within the culture within which that particular technology is going to survive. And that's where the public-private partnerships are very important. It's wonderful to see Mr. Shams over here, because I think that kind of partnership is what is going to help to bring about a multiplier effect. As I said, the chapter was based on leveraging, and that's how one of the ways by which we can leverage the scalability of these projects, particularly in low and middle income countries. The good thing about technology is technological innovation is usually flexible and is malleable for adaptation, and that is something which is excellent. Finally, I want to leave you with a quote which is from that particular chapter. It comes from the WHO draft report. At that time, it was a draft report in 2019, the Global Strategy for Digital Health 2020-2024. The vision is to improve the health for everyone, everywhere, by accelerating the adoption of appropriate digital health. If I have to bolden one word, that would be appropriate. Thank you so much for this opportunity. Look forward to further presentations and discussion. Thanks a lot.
Thank you, Dr. Sankaran. That was absolutely excellent as well. I'm now going to turn the presentation time over to Denise Scotto, who is an attorney. She's also an international policy advisor to the United Nations.
Thank you so much. I appreciate the opportunity to be with everyone tonight. Although I'm not a medical doctor, I am a juris doctor, and lawyers are in the United States known as a JD. I really want to give such gratitude and appreciation to you, Dr. Amy Ansehl, and to you, Dr. Padmini Murthy, for the foresight and the vision of putting together this important book, and for close collaboration through many years at the United Nations around our common issues that we value so much. Speaking of the United Nations, I'd like to bring into the spirit of the United Nations. We've heard from some speakers today a little bit about the WHO, the Sustainable Development Goals, but I'd like to bring into the aspect of the United Nations and how there are many legal treaties that provide the idea and the human right of health to all peoples everywhere. The ability to access health, education, access medical treatment is something that is so critical, that's enshrined in many specialized conventions, but also in various policies that are promulgated in many different programs throughout the United Nations, not just through the WHO. My chapter deals with law, it deals with technology, and it deals with global health. And I have a lot of different best practices and different definitions, from telehealth to telemedicine to e-health to mHealth, but I think that our speakers tonight have already explained that. And for those of you reading the book, then you can take a look to have a better idea of what that means, because there are some differences. The particular topic that I've addressed has many technical issues and ramifications on it. because at the end of the day, when we speak about these areas and the confluence of them, we do speak about things that are very cross-cutting. The law is a cross-cutting subject that deals with so many areas when we talk about global health, but also technology at the same time. So some of my information deals with the technological aspects of interoperability. And Mr. Shams and those who are involved in creating a lot of the apps and many of the platforms that are being used right now would understand the significance of interoperability. And I don't need to get into that, but you can read more about that and, do some more research about that. But that is such a critical area. And I learned about that from working on a particular legal case. The other areas that are technical in the sense of that goes in hand with one, security, data security, privacy, those kinds of important issues that we really do need people to be working from an engineering, a technical engineering standpoint. And there is a lot of data regulation, privacy regulation, and as you know, HIPAA regulation in the United States. So that's one particular area of law that deals with these technological components. Another area of law that deals with something different deals with medical services, but the reimbursement and the money that goes to paying for those services, be it through health insurance companies, be it through Medicare and Medicaid. In the United States alone, back in November, we've had a lot of legislation go back and forth about, is telehealth covered? Are there laws in different states that cover telehealth? There are 35 states that have parity laws that cover telehealth. So this is another very technical, detailed, specialized area. But I bring it up so that you're aware of the full idea of this idea when we talk about telehealth and what it means. It's not just program delivery on the ground to people. It's much more broader than that. Of course, the program delivery is significant, and we've heard about that and good examples. The way Dr. Amy Ansehl has talked about it, the way Dr. Gopal has talked about it, the way Aishu has talked about that with the mHealth initiatives, the way we've heard about how it's so important when we speak about responding to natural disasters and to conflict zones and things like that. So I don't want to get into that. Another area of the law that we see that's more up and coming and that I think is getting more and more popular and more frequent goes in hand with antitrust legislation. Because as we have more of these companies that are providing telehealth services, for example, like Teladoc, which many people know has been buying up smaller and smaller companies, I think from a competition and antitrust standpoint, there will be more of a trend to examine these kinds of mergers and acquisitions. So there are a lot of areas of law that may at first not seem to be significant, but this is giving rise to so many different specifics that one may not think about. I'd like to just briefly talk about some statistics because I think this informs us that we may not be aware of. The financial value of telemedicine visits this year alone, meaning 2019, was more than $29.3 billion. This was according to a report from Doximity Physician Network. That's incredible if you think about it, $29.3 billion. And the number of physicians reporting telehealth as a skill increased 38%. Think about that. That's pretty amazing that physicians themselves are thinking about telehealth as a new skill. Since the coronavirus pandemic, The number of Americans participating in at least one telemedicine visit has increased by 57% in the last year alone. So we know COVID-19 has had very important ramifications in the practice of medicine and how people access those services. The other thing that I want to talk a little bit about is how men and women doctors are using telemedicine, and the statistics bear out that women physicians are using telemedicine more frequently than men are. And that is a very interesting topic when we talk about AMWA and how their members are delivering services around the world. Those are just some areas I think that we need to be on top of. Another area that I want to finalize and close with is now with telemedicine and the ability to provide medical services and treatment across states. Medical licensing has changed, and we know that there is a movement to have a model compact where physicians from different states can become accredited in other states through this special compact. And we know that there are at least, I believe, 24 states now that have joined this. So like the law, the legal field, doctors are licensed in individual states across the United States, and there is a movement for more universal licensure. And it's not just for medical doctors, but for nurses as well. And I'm sure Dr. Ansehl is aware of that. So there are a potpourri of issues that I just was wanting to put up front, because we may not be aware of this, or if we are, we may not think of it the way we think of when we think of other issues, when we think of telemedicine and the broader aspects of that. So with that, I'd like to conclude. And again, I so appreciate the opportunity to be with everyone today and my esteemed colleagues and editors. Thank you so much.
Thank you, Denise. I mean, you've done a great job of summing up and tying up a lot of integrating, a lot of great points about pulling us all together, relating it to doctors, nurses, to AMWA, to all of us here this evening. That was very, very helpful. Dr. Murthy, would you like to give us some concluding, before we get into the we're going to do a Q&A. We are going to do that, but would you like to give?
We have a few questions which have been answered, but somewhat. Thank you so much, Dr. Ansehl. And always, as I say, you and Eliza are my partners in crime. We do all these things together. Before I give my concluding remarks, I would like to give a big shout out to all our attendees too. I mean, our panelists, our book would not have been there, but just very quickly to sum up, technology is here to stay. It's a disruptor I can say it can be used as a positive disruptor, or it can be negative. And we talked about why when it's used to harass somebody. But the thing about technology, especially during COVID, which we all learned, is we are all connected. We are sharing data. We are sharing our work because of technology, whether it's as an emergency care physician, what Sean does, what Denise does with her brilliant legal mind, putting all the pieces of the puzzle together, what Dr. Sankaran has been doing as a great professor for so long and having worked in the WHO, how to tie in a technology, and our youth, Roya, Aishu, and Renuka, your co-author, what you have been doing, and Toshi as the physician diplomat, and Amy, not only what we have been doing as a physician and a nurse, but also as teachers, because this is what we are doing, and public health professionals. Whether we like it or not, we are all involved in health because it's a three-dimensional puzzle. And also Dr. Gokula, for how you are looking at introducing technology, low care technology. And Dr. Shams, we need people like you with the industry, because it's an example, as you said, about private, public, academic partnerships. And also what my dear colleagues in AMWA are doing. We have been around for 105 years. It was started by an American woman physician with foresight, and now we all use technology. And Denise, thank you for bringing up that point of how women physicians are using more telemedicine services. It could also be because you have all these apps where you're connected. Even though we are zooming in from different parts of the world, we are still connected. So I think technology is a great connector. It's a disruptor if it's used in the positive way. And I think one of the things is that we all get together to share our knowledge and to help improve the health and well-being for all, because what technology is doing is hopefully to reduce the chasm of inequality. So that being said, Amy, we are going to go over to the Q&A, and I think already one was so I am going to start with this question because some of them were already answered. This is from HRH Prince Adnan El Hashmite. And the question is, I think specifically to you, Dr. Gokula, the question which was asked by Colleen Brennan, if there are any programs that offer free medical training via education apps for developing countries. So Dr. Gokula, the question is to you.
Yeah, thank you. I want to kind of follow up Denise.
Because we want to get to all questions, sorry, I'm putting my moderator hat on. Those of you who know how I moderate, you have 35 seconds to answer the question. Thank you.
I like the way Denise has put everything together. United States has a very structured way of delivering telehealth and medicine with federal grants into 7 regions and telehealth resource centers, and outstanding work has been done in those in trying to give free resources. And you just Google telehealth resource centers and you can see which region you belong, and you can actually get, and this is all free. They give you free consults. And one of the best programs that I love is Project Echo. And it's from University of New Mexico. It's one of the most evidence-based platform, and it's free. And I was talking to some of the panelists privately, and I used it in state of Ohio to disseminate Choosing Wisely campaign when I was the president of Ohio Medical Directors Association. And all the developing countries can use this and have a major role in one of the big areas in the city, and then disseminate to the rural areas. And it works. And they use Zoom. And that's how I ended up using Zoom in India too, because I had so many technology problems in trying to get the bandwidth and local politics that come into trying to get bandwidth. And Zoom really helped. And I could just switch off the video, and still have audio in low bandwidth. And I would like all participants to just Google Project Echo, and it's free, and they do a wonderful job.
Thank you so much. The next question is from one of our esteemed colleagues from Canada, Dr. Ross. And this question is, in Canada, where I work, there is concern about fragmentation of healthcare with all the virtual-only services proliferating. We are looking in to see how we can link payment for virtual care to connection to a longitudinal care provider. Is there a concern in other countries as well? Sean, would you like to take a stab at that?
Yeah, definitely. I think it's a problem everywhere, here in the US, but also even more so globally. And it's one of the things technology is solving, and we're watching it solve it in real time. It's the availability to just be able to connect with somebody. Dr. Scott mentioned Teledoc, but there's so many other organizations out there too. And even here in Boston, since COVID, we're using Zoom or Microsoft Teams, and we're doing in Doximity, we're doing virtual visits, and it can scale up the availability to get follow-up. I think of it in the ER when we see a patient acutely and then they need follow-up. It's so hard to get them into longitudinal care because of availability, and this can overcome so many barriers here, but everywhere in the world. Like I mentioned, with mobile phone penetration being as high as it is, the access is there, the infrastructure is there. We just need to use it. And in some ways, COVID has actually really advanced our use of virtual technology tremendously, I think.
Sean?
But Dr. Murthy, I want to kind of add to Sean's thing. COVID was a disruptor, but you have to understand that all the rules were hands down. They were removed. The HIPAA, the rural health divide, where you can practice telemedicine, how all the rules were all taken off. So the payment was one that was holding up use of telemedicine in the United States. And then also the barriers that were erected saying that you can do this in rural area, federally health qualified areas. So some of those things in developing countries, it's an advantage that you don't have to go through all these rigid rules, you know. And this should teach that with COVID, how everybody adopted. I mean, I was very busy the first week of COVID, but the second week it came down, third week. So it took about 4 to 6 weeks. I think the local physicians in Ohio, everybody was using telemedicine.
Thank you.
know?
Sorry, we have another question and we're running out of time. Thank you. Not to cut you off. The other question is for all the panelists, do you have any virtual programs for youth or undergrads? Dr. Sankaran? Anything to add to that?
Thank you for the question. I think when we look at platforms like Coursera, edX, etc., these are providing a tremendously large array of courses, many of them either very low cost or several of them free. And I also saw a question which was related to whether these are available on the mobile phone. Yes, Coursera, at least I know that that's available on mobile phone. So the answer to both questions is yes.
Thank you so much. Dr. Ansehl, do you have anything to say? Because I think all the questions have been answered. And, you know, oh, yes, I have one more question.
There was one more.
Sorry. Yes. Amy, do you want to, that's from Tony Sozo. Would you like to ask a question?
Should we integrate, there was a question, should we integrate telemedicine into health profession schools, academic teaching programs? And I know there are a number of us here, they're probably all nodding. I can see it as I'm looking at all the different squares. But absolutely, I think it's essential to really be teaching students about using technology, about telemedicine, about telehealth. I think that I really see courses. I mean, I've started using it in my practice as part of my work. I'm actually doing environmental consults, virtual environmental consults for asthma, you know, with children and their families, once again, in their homes. I guess the theme here is I'm very interested in the home, bringing healthcare to the home. And it's incredible that you get to actually see a patient in their home. So when you talk about environmental triggers, you know, you can really see them and then you can come up with an intervention. But I never had any formal training in that, you know, so I think there's a real advantage now to training doctors, nurses, therapists of all kinds. So I'd like to turn that over to anybody else on the panel who wants to add to what I'm saying.
I think I would just like to jump in for a few seconds to add to that question. One of the other things what we are doing, and one of the things, Eliza, which we worked with one of our other NGO partners, we kind of use telemedicine even to, you know, to discuss about how to provide PPE. So things like that, we are using telemedicine. And one of the things I found is when talking to my other international colleagues, we are using, I would say, we even compare notes on telemedicine because it's a great tool. So I would I would change the name to tele-teaching as opposed to telemedicine, because basically you're using technology to teach and discuss. So I think we are. Anybody else on the panel? Sean, Murthy, Gopal?
Yeah, I mean, to add to Amy, that's right. You know, I'm a geriatrician, so I do home visits, and some of the patients had issues during COVID, and technology was a good barrier. I mean, it broke the barrier wherein the families allowed me, and then we could actually see the home, assess the house, look at the refrigerator, and kind of give them education, you know, post-surgery, how when they were discharged and the rehab. So it was a good in, and telehealth is the education piece, as I've just said. Project Echo, if you sign up, there's so many education programs in all areas of, and it's a universal collaboration. You can, and all that. So it's education is happening already.
Thank you. Gopal, do you have anything to say to that, Sean, with regard to your academic background? how to use it?
We actually are incorporating into the medical school curriculum here this year for the first time ever, because it's become so prevalent, which is great, and it will stay going forward as far as I can tell. And another thing I wanted to mention, even before COVID, we had a program called the Home Hospital Program at Brigham, which is incredible. And instead of admitting people to the hospital, they go home, and there's a team of physicians, nurses, and paramedics that actually does the inpatient management in their home. And talking to these guys, I work pretty closely with them because they pluck people out of the ER, and it's an amazing, amazing program. And for all the reasons that everybody else has said about identifying environmental triggers, you can really solve the root of problems.
Thank you so much. Gopal, do you have anything to add before
I would just say that Dave, with chronic disease management and the increase in chronic diseases globally, telehealth, telemedicine, telewellness, anything tele is going to be crucial, because that's going to be a central core of the strategy in terms of looking at chronic disease management. And I don't mean chronic disease management only, but on the other side, the lifestyle management.
Yes.
Thank you so much. May I request, I think we could have a screenshot. I think Kayla, can you take a screenshot of all of us? And I think everybody needs to be on a screen move so that we can have a screenshot. And again, I would like to thank all of you and turn it over to Eliza. Within time, we have 2 minutes, Eliza, for you to make your remarks.
Well, I just have to say, this is wonderful. I was really blown away by all the expertise here and the different angles and where this conversation went. I want to say that I was just in a conversation with someone yesterday about telehealth as a webinar that we want to bring to our membership. Many physicians adopted it kind of by the seat of their pants when COVID hit. But now that it looks like it's probably here to stay for a while, it's good to be thoughtful about it and see how we really can maximize telehealth to really make a difference in the care that we provide to patients. And I think the conversations and the many points that people brought up today are a start in that direction. So I just wanted to thank everyone again for their expertise. I think technology is another great example on how we can all come together. I remember conversations where my husband and I are in the kitchen and we are on with a team from Afghanistan, seeing how they're working on the ventilators. So technology brings people together in a way that we haven't accessed before, but I think with the COVID pandemic, we have learned to embrace it. So thank you all for your expertise. Thank you for allowing AMWA to host this, and we look forward to promoting more of these events and promoting the book and all of your expertise.
Thank you so much. And the link will be available, which will be shared, right, Eliza? Because already people are sending messages. So
yes,
thank
absolutely.
you, everybody. Stay safe. Thank you so much, AMWA. Thank you, Amy. Thank you, all the panelists. Thank you so much.
Thank you all. Thank you,
Thank
Dr.
you.
Murthy. Thank you, panelists. Thank you, audience. Thank you,
Thank
AMWA.
you, Kayla. Thank you.